An example of cancer treatment being adjusted or followed and analyzed by tumor vessel imaging is adenocarcinoma, which is the usual cancer in the pancreas. The graph shows the vessel density at 32.9%. This patient opted to be treated with complementary methods. A lot of people come to me because they refuse surgery and want to try natural or minimally aggressive alternative or even experimental treatments. We can see that 6 weeks later, the alternative treatment worked because the vessel density went down from about 33% to 5%. As a follow-up 2 months later, the patient stopped the treatment and the vessel density shot up back to 23%. So this is a quantitative means of non-invasively telling if a cancer therapy is working or is not. And it's a real-time validation of success because you've got the tumor and the treatment effect in front of your eye. Genetic testing overall has 60% accuracy. For example, the study from Memorial Sloan Kettering showed in melanoma diagnosis, it was a 55 to 63% accuracy in a year-long study. Gene tests in the pancreas have similar accuracy to clinical testing. Your risk is increased if there is a BRCA gene positivity in the family, or there's other genetic family syndromes such as the Lynch syndrome and the Peutz-Jeghers syndrome, which caused a high incidence of gut-related tumors or GI cancers such as colon cancer and small bowel cancers. Now, in the rest of the world, other technologies are used. For example, in 1974, when I trained in Denmark, the surgeons there were doing imaging. They were actually putting needles into a pancreatic mass through the skin with local anesthesia to get the sample of the tumor. This was forbidden in the United States until 1999, and even now used sparingly. This slide shows that the pancreatic tumor can be seen with multiple technologies. The bottom image on the left, A, the green area shows that the tumor is benign or fatty tissue. To the right of that is a small dark area on the sonogram. And interestingly, the last image, D, is done with a handheld portable ultrasound unit that shows a 1 centimeter mass deep in the body of the pancreas. Contrast ultrasound is also being used all over the world, and it shows the cancer vessels where the tumor vessels feeding a cancer are. In this case, a pancreatic tumor, and the blood flow shows up in seconds following intravenous contrast, which is safe. So unlike the CT or MRI contrast, there are no side effects from contrast ultrasound injection. The contrast ultrasound shows the white arrow pointing to a huge pancreatic mass. This is the common way that pancreatic tumors are assessed using MRI and contrast to show the location and pre-surgical planning of pancreatic cancer procedures. CT staging with molecular biology or radioisotopes is used to find the tumor and to stage it. In other words, the PET-CT scan is a radioactive tracer study to show where the tumor is and if it's getting better. An example A on the left, you see the tumor under the arm, and the follow-up study some months later shows that the tumor has spread. This is an indication that when you look from one black tumor dot to 3 larger tumor dots in the same treatment, then the therapy needs to be readjusted. With the Endo ultrasound, benign tissue is green, the liver tissue is blue. This is a technology that's been used for 30 years in Europe. And in cancer screening worldwide, it is being used to avoid biopsies in the breast, the thyroid, the skin, the prostate, the pancreas, and liver. It is highly accurate and used as a primary screening tool more and more. So elastoendo ultrasound means you're putting a tube in like an upper GI series or an endoscopy, where the tube goes into the duodenum and uses the probe to image the affected area of the pancreas. While this is an invasive procedure, it avoids biopsies sometimes. Teamwork helps to get the job done, even if all the participants involved aren't necessarily individually and separately compatible. But as a team, it's a way to go. It works very well. Thank you.